Hello, my name is Isa, and I will talk today about the patronage model, the new patronage model, on the example of the case from the polyclinic number 9 at Nur-Sultan. So this is the outline, and first I want to talk about the patronage model, describe it. Then I want to describe briefly the case, the family that we worked with. Then I want to talk about what was done to the family, outcomes of that, and some literature review that is relevant to the case. So this is how I wanted to summarize my presentation, the main idea of my presentation in the 6 pictures. So you want to make an association with that and know what to expect. So I'll give you 3 seconds. Okay, 3 seconds. So this is how the patronage model was set. So there was a decree, and then in 2017, and after some organizational moments in 2019, the polyclinic number 9 has set up a special office of the UPPM, the Universal Patronage Progressive Model. And the purpose of that is of this office is specifically work with families with risks. Basically how this is done, so we have a GP sees a family and then defines a risk. And if it's the low risk family, then this family gets the universal package of services. And if it's the medium or high risk family, then they will get an individual plan and progressive patronage. So how do we define risk? So the low risk is the usual family we see every day. Then we have medium and high risk. Medium risk is families with some difficulties, with some stress, with children with difficulties in feeding and problems of development. And then the high risk is highly vulnerable families. This is quite a subjective definition. However, all of these families get individual plan and enhanced support. So this is the universal model, the package of services that every family gets. This is performed by the radio GP nurse in the polyclinic number 9. I don't want to spend my time on that, so please. So this is the progressive model. This is done by the patronage nurse from the patronage office. It includes additional visits and individual plan. So this, now I'm going to talk about the profile. The case, this is the high-risk family, woman and 2 children. This is the social profile. I hope you can see what is written here. Basically, this is the family, woman, 2 children. She is with her parents and her brother in one room apartment. And the father of the children, her partner, they are not married legally, and he was in prison at the time of the patronage. And her father is quite aggressive, and her brother too. And father abuses alcohol, smokes cigarettes at home. Father and mother of the woman are janitors, and the woman and her brother, they don't have a job. So here are living conditions: 5 people in one bedroom apartment for rent, own kitchen, own bathroom. So overall, at the time of the first visit, it was not clean, the apartment, and the conditions were not safe for children because they were rolling kid on the floor, bottles from alcohol under the table, etc. So woman was overall healthy. She was complaining of lice in her hair. She was in emotional distress, according to the psychologist's notes. And she was not willing to cooperate with the GP, but she was cooperating with the nurse. And she didn't have a job, education, 9 classes of school only, and not socially adapted, so didn't know how to make documentation and things like that. This is the first child, overall healthy. Some speech development impairments, probably due to neglect. Second child has delays in the development. At the age of 1.5 years, he didn't stand, didn't walk, didn't speak. Developed respiratory attacks during crying, didn't have a vaccination history, and overall also had signs of neglect, according to the psychologist's notes. So this is the echo map of the youngest child. This is how the team works. They construct this map. And these lines, they actually represent the quality of the bond between the child and his relative. So this is, here I want to talk about what was done with the family. So there was a team that worked with this family, and it included the patronage nurse assigned, social worker, psychologist, and a GP. And there were attempts to make some major life changes with this family. Here I deliberately chosen this picture of a road. So this is like a pathway of the ongoing work that was going on with this family. And I chose that it has its turns and twists because it wasn't easy for both the family and the healthcare provider. So what they did basically first, they did frequent home visits, they provided with the necessary information, educated the family on the importance of the proper child nutrition, proper education, and the safe environment. Then they placed the family into the youth refugee house for 6 months because the environment was not safe at home. So they timely provided the family with medical and psychological assistance, helped how to make appointments, were also always in contact through the WhatsApp, treated and washed off the lice at home, so this woman helped this woman, then had provided her with the free copper IUD for family planning. Then they planned a individual rehabilitation plan for the youngest child with developmental delays. They got the social help, so they got necessary items from the donation center from the polyclinic, and also they aided with the social adaptation, so they helped getting the state ID to the woman, and also helped getting disability allowance for the second child. This is how the team works. This is ongoing process. I used this photo with the permission. I couldn't use photos of family. There were a lot of photos, but I didn't get the permission. So basically, what was the outcome? So there was 1 year of follow-up. The patronage was established with trustworthy relationships, and has educated the women, and the improved nutrition was improved, safety was improved. The woman lived at the unit for 3 months, then got back home. She gained disability allowance, so she got her own money, and she finally moved out the parental house. Then she got a state ID, and she was educated on how to treat her children properly. So, and a bit of discussion, a bit of theory. First, I want to talk about the sociological framework. I couldn't help using it because I'm a sociologist. And the attachment theory is by Bowlby. It talks about children actually, but this is very important and how patients and healthcare providers, they also get this kind of attachment. And here, patronage nurse really established the relationships, and it really aided in the change process. Then the interdisciplinary teamwork is very important, and it is associated actually, so it's better for patients and the healthcare provider, and we have some clues to better work. So it's clear work boundaries, clear goal setting, collaboration, and vertical relationships, and all of these things were trying to be achieved by the team. So, and actually this model has the potential to alleviate the burden from the GP, so it's kind of time saving for the GP, the teamwork. So overall, this was the case. And this patronage office continues its work, deals with different patients, different families, and I just wanted to emphasize for the future we could do some study on how did the families, this family's quality of life improve or changed after the patronage, like after the patronage follow-up. Could be both qualitative, quantitative. This is just an idea for the future, like a conclusion. That's all the references.